Hey guys, this is Dr. Hub. Today we'll look at the 3-point bony relationship in the elbow. So the 3-point bony relationship, it includes the tip of the medial epicondyle. So it involves the tip of the medial epicondyle. Next is the tip of the lateral condyle. So it is the tip of the lateral condyle. So it is the tip of the medial epicondyle, the tip of the lateral epicondyle. Next, what comes is the olecranon. So all these, they form the 3 tips in the elbow. So it is the tip of the medial epicondyle, tip of the lateral epicondyle, as well as the olecranon. Now, when the elbow is in 90 degree of flexion, so when the elbow is in 90 degree of the flexion, so what is seen here? So in terms of the elbow in 90 degree flexion, these points, they form the isosceles triangle. They form isosceles triangle, and that is when the elbow, it becomes extended. So when the elbow, it becomes extended, they lie transversely on the straight line. They lie transversely. This is in a straight line. Next, the 3-point relationship, this is maintained. This will be maintained. So let's have a rough diagram. So this is in terms of the 90% of the flexion. Then when you're looking at extension, it is going to look like this. This is nothing but the olecranon. So the elbow in 90 degree flexion, these points form an isosceles triangle. When the elbow is extended, it transversely, they lie transversely in a straight line. So these are some important points to note. Now, the 3-point bony relationship, it is maintained in case of supracondylar fracture of the humerus. So it is maintained by the supracondylar fracture. Supracondylar fracture, and it is nothing but the supracondylar fracture of the humerus. This is as the fracture occurs above the level of the landmarks. So the conditions where it is distorted. So where is it distorted? So distortion is seen in terms of the fracture. This is fracture of the medial epicondyle. So fracture of the medial condyle. Next is, it is also seen in terms of the fracture of the lateral condyle and the epicondyle. So medial condyle and the epicondyle. Next is, it is also involved in terms of the lateral condyle and the epicondyle. So it is seen in terms of the lateral condyle and the epicondyle. So it is a fracture of the lateral condyle as well as the epicondyle. Next is the intercondylar fracture of the humerus. The intercondylar. So the intercondylar fracture of the humerus. Next is the fracture of the olecranon. Next, what we are seeing is the fracture. So this is the fracture of the olecranon, and also the elbow dislocation. There is also the fracture of the elbow dislocation. To learn and grow daily like this, please do subscribe.